Okay, good morning, everyone. Hello. Thank you all so much for joining us this morning. We are so excited to be here in community with you all. It's really great to see so many familiar faces and also a couple new ones. My name is Yvonne Jimenez, and I am the SVCN Policy Director. My pronouns are she, her, ella. I want to thank you all for joining us for such an important event. As you know, the county is undergoing many leadership changes. There's a new supervisor, a new COO, a new CEO, and we're glad to provide opportunities like this so that members of our nonprofit community can get to know those leaders and begin building relationships. In the case of Mr. James Williams, we are starting that early. He begins his role on July 1st as incoming CEO, and we appreciate his willingness to be here, to join us, and to start up the dialogues that we know are so important for our nonprofit members. We do ask that you share this on social media if you feel compelled to. And just before I pass it over, finally, as part of our continuing and evolving practice with SVCN, I want to acknowledge that here in Santa Clara, we are gathered on the ethno-historic tribal territory of the Tamian Ohlone, who are the direct ancestors of the lineages enrolled in the Muwekma Ohlone tribe, and who were missionized into the Mission Santa Clara and San Jose and Dolores. Together, let us commit to educating ourselves and advocating for our indigenous peoples, communities neglected and displaced by the U.S. government and other colonial powers around the world. We encourage you to learn more by engaging with local indigenous-led and serving nonprofits in your community. And now, without further ado, I will turn it over to our CEO, Clara Kazantzis.
Thank you. Thanks, Yvonne. Thanks. Can everyone hear me okay? Cool. Thanks to the whole SVCN team for getting us to this point. They're there in the background getting you in, getting the food here. They're going to be taking your questions with microphones around the room. So we'll thank them again at the end, but I wanted to start off by thanking everyone who's doing all the background stuff. As Yvonne said, SVCN's really proud to be able to host this kind of event where our nonprofit ecosystem can come together with community leaders and share our mutual priorities, ask questions, and get to know each other better. So this is, one of our core functions, and your presence is necessary for us to do that. We're going to dive right into the town hall program and tell you a couple of the things that we expect to happen here. This slide highlights the main topic areas that our moderators are going to be covering. These questions were prepared by the SVCN team and our moderators after we reviewed questions that many of you submitted for consideration when you registered. They also reflect many of the policy areas that are SVCN's 2023 priorities. In terms of the format of today's event, we're going to kind of try to mix it up here and make it exciting. I hope it works out structurally, but we'll be alternating between moderator questions and audience questions. The hope is that when you hear a question on a particular topic and you hear James answer and you have a follow-up question, you will ask that question at that time. So one thing just to remember is that we'll be talking about all these things. So if you have a question on a different topic, we'll probably get to that topic. And also there should be time at the end to ask additional questions as well. So I guess we're kind of like gently suggesting that you stay on the topic that we're discussing at that time. If that makes sense, that we're experimenting with this. So, if you all do your job, we'll just keep doing it this way. And also when you want to ask a question, or if you already know you're going to ask a question, you might want to look around and see who's available for a microphone. There's a couple team members around for a microphone. And that way we minimize the friction of getting someone to run over to with a microphone, and we save time for more questions. So kind of like, I know I'm going to ask a question, go ahead and just, raise your hand if you know that it's pertinent to what's being discussed. Yeah, except for Kathleen. Kathleen is not allowed to have a microphone. Just kidding. You're only limited to 3 questions. At this time, I want to introduce you to the moderators, and all 3, you probably know these folks, and if you don't, I want to tell you that they're phenomenal nonprofit leaders. They're also all 3 active members of SVCN's Policy Council, and they're representatives of collectives of nonprofit organizations. So first we have Sujatha Venkatraman, who serves as the Interim Executive Director at West Valley Community Services, and she's also an active member and past chair of the Emergency Assistance Network. Next is Elisa Koff-Ginsburg, who serves as the Executive Director of the Behavioral Health Contractors Association. And last but not least, David Lowe, Director of Policy and Communications at Destination Home, which serves as the backbone entity for our collective efforts to advance the community plan to end homelessness. Definitely not last but not least, I'd like to introduce today's speaker, James Williams, the county's current county counsel and incoming chief executive officer, as you heard. James, great to have you. Thanks for giving us this time. And we're going to start it off. I have a couple questions. I'm not going to intersperse these with audience questions because these are just softball questions for James so that he can really introduce himself. The first is, share a little bit about your background and your overall career journey with us.
Well, first of all, thank you. It's great to be here. Great to see all of you. Good morning, everyone. And huge thank you to you, Clara, and to the entire team for organizing this and putting it together. I know it's a tremendous amount of work, and I've been very impressed, by the way. Thank you, Alan, and everyone with all the logistics and the coordination and just how well you've put it all together. So I wanted to start with that. Thank you. This is always a tough question when you're asked to kind of introduce yourself and talk about kind of where you come from, who you are, what you do. So I thought, I'll start a little bit with some of my background before I talk about my time at the county. So I am a first-generation American, was born in upstate New York. When I was I'm an only child, and when I was young, my father passed away, and we moved over to Portland, Oregon, which is a city I love. Happy to talk about Portland with anybody. It's a beautiful, beautiful city. Grew up in Portland, was through really, I would say, the interest of my mother, who's a professor of education, had a strong passion, interest for public education issues. And that was kind of my entree into getting interested in government. And I was a weird kid. I was very nerdy about government issues. So I've always been, since I was very, very young, into local government and budgets and all that. You'll probably see some of that as we get to some of the questions about those sorts of things. But growing up in Portland, it's a wonderful, progressive, innovative, beautiful city. It's also, a city that is in community. It's very different than here, especially when it comes to diversity. Grew up, especially back then, but it's even true today, one of the whitest major city in the United States. And not one that really has any awareness of or identity of kind of the richness of different cultures. It's kind of white and then non-white. It was very binary in that sense. And so that definitely affected my experience growing up as basically the only, which will I think sound weird to folks who've grown up and seen this community over the last several decades, but in many cases the only person with parents who were from India in my entire school or in the community, which again, you would never, experience that around here. And even in Portland, I think today is very different than it was then. Loved my time, though, in Portland. Was very active primarily around school-related issues and in the political community there. Also a lot on environmental issues and issues of sustainability, which, Portland's rightly known as a national and international leader. I eventually made my way here to the Bay Area for law school, and always planned to go back to Portland, and my wife's from there, and we were going to make that our home and work in some kind of public sector setting there because I knew that's what I wanted to do with my life. and got encouraged to apply for this fellowship position that was a one-year fellowship in the Santa Clara County Counsel's office here in Santa Clara County, with something that's pretty unique to our local government here, and won't surprise many of you, which is we have a social justice impact litigation team in our county counsel's office that was created in around 2008. And I applied for this one-year fellowship, thought, okay, I'll do that for a year. I took the Oregon bar and thought, okay, I'll head back to Oregon. And did that fellowship for a year, and loved the work and the people and the issues that I got to work on in the county counsel's office here in Santa Clara County. Maybe I'll talk a little bit more later in one of the questions about one of the things that I ended up working on in that first kind of year here at the county. But it's an issue that, from my perspective, my lens, is really an important social justice issue. And it has to do with how we allocate funding. And that is an issue some of you may have heard of related to the dissolution of redevelopment agencies. Seeing some chuckles in the crowd. But I ended up working on a case where the county took a position that resulted in dissolution of redevelopment agencies across California. And what that case was about to me is it was about choices around how we allocate our ongoing property tax revenue. Because the way those agencies were funded, I'm not saying they didn't have some projects that were really wonderful, good projects, just to be clear. But the way they were funded, the mechanism for funding, was by diverting property tax revenue from counties and schools primarily, also a little bit from city general funds, to these special purpose entities that were designed for economic development. But that was ongoing revenue year in and year out, 12% of all property tax money in the entire state in 2011. $5.5 billion a year that was being diverted away from funding ongoing services that could go to fund salaries for teachers, nurses, sheriff's deputies, CBO contracts, other ongoing services. And it was coming at a huge cost, but an invisible cost, because the mechanism and structure behind that funding around tax increment financing hid those choices and decisions from policymakers, because it looked like a dedicated independent revenue stream, and there were different people involved in the decision making, so it wasn't an actual choice that was being made, notwithstanding the fact that in reality it was a diversion of revenue. I worked on that case, and that led to a kind of a whole body of work, and ended up moving to the county executive's office. And something that I've been consistently surprised throughout this transition that people seem to forget about from my bio is I worked for 4 years as a deputy county executive in the county executive's office. And in that role, had the wonderful opportunity to oversee a really diverse set of county departments. Everything from 911 and county fire to risk management and procurement and contracting, which I know we'll talk about that a little bit later. And got to work with just a whole range of issues. I was helping run our bail and release work group and project, and all sorts of other things, our Emergency Operations Center and Office of Emergency Management. Loved that role. Loved the variety of the work, loved the operational issues, loved working with the department heads on trying to solve problems. And in 2016, the board reached out and asked me if I would go back into a legal role and come back as the county counsel. So I did that with a little reluctance, actually, because I actually enjoyed being kind of out of a lawyer role and in an operational one. But stepped into the county counsel's role in 2016, and a couple months later, things shifted pretty dramatically for us in what we thought we'd be working on with the election of Donald Trump as president. And we quickly pivoted, and as many of you I think are aware, really played an important leadership role, and I'm very proud of the work that our county counsel's office did in being one of the local governments that was really positioned to take an aggressive, bold, strong stance in protection of immigrant rights, healthcare issues, census, DACA, so many different domains. Very successful litigation docket to push back against what we were seeing coming out of Washington, D.C. We pivoted the work of the office to do that, helped build a lot of coalitions legally to do that work, and it was very, very meaningful work to help to be in a position to really lead and directly work on during that time. I'm very proud of the County Counsel's office and the work that it does. I know it's not as visible by its nature to a lot of folks because, of course, most of the day-to-day things that we do are privileged and confidential and internal to the county organization. That's kind of the nature of the business. But I'm very proud that it's an office that really, I think, represents excellence in public law and in legal service, and that also has a really active affirmative docket of work on behalf of the people of the state of California, whether it's our lead paint or opioids litigation or the work that we've done in many, many other domains. And the work that we've been able to do in partnership under the leadership of the board to help drive and bring forward innovative policies that this county is really known for. So I'm very excited to step into this new role as the county executive. I've, of course, worked very closely with Jeff Smith for my entire time at the county. Worked literally for him as a deputy county executive, but gotten to work with him as a colleague, as the county counsel. I'm delighted to work for a board that is willing to be bold and is willing to take strong leadership positions and do things different from other counties in the state. I'm delighted to work for a county because of what counties represent. When people ask me, why I work in Santa Clara County, I always say it's the mission and it's the people. Counties in California represent the safety net, as you all know, but I couldn't think of a better level of government to work in than the counties. I couldn't think of a better place than Santa Clara County specifically. It has absolutely become my home. I have 4 beautiful children that we're raising here in Santa Clara County. We love it here, the diversity, the richness of the fabric of this community, and the boldness and innovation of the county as an organization, and the investments that we've been willing to make. I mean, who else would have bought hospitals out of bankruptcy, taken on that risk, huge risk, taken on that cost, taken on that work, and how fortuitous, given what happened just a year later with the pandemic. Who else would have stood up to take the protective measures that Dr. Cody took and that I'm very proud to have helped support in protecting our community in COVID and leading the nation in those efforts. So I'm so excited to be in a position to help lead this organization, to work with such talented people, and by extension with all of you, because I know that through your work with the county, you're part of that community, and that is how I see it, and part of that broader system. I'll pause there.
Oh, that was me. Sorry about that. Sorry, I just had a little itch there. Thank you so much, James. I think what we're going to do to just keep things on track is we're going to jump to moderator questions. Sujata has 2 for you, and I'm going to let her take the mic.
Thank you, Clara, and thank you, James. My question is around nonprofit partnership. As you know, nonprofits have many different relationships with the county. Some of us offer complementary services. Some of us have contracted services with the county. Many nonprofits refer their constituents and clients to the county services. And we are also involved in stakeholder inputs for programs and policy. So my question is, can you share how you see your office and you interfacing and partnering with nonprofits? And can you highlight the differences you might have in your approach?
Sure. I think I'll just pick up where I left off, I think, with the last question. I really do see the safety net services that the county provides. Of course, many are provided directly by the county and county staff, and many are provided by our service contracts with CBOs. And sometimes it's a combination of both, and sometimes it's more one, and sometimes it's more the other. But it's all part of delivering excellent service to those that we have an obligation, a moral obligation, duty to care for. And that's something I care a lot about. I care a lot about quality of service that we provide. I care a lot about being able to figure out ways to try to expand the service that we provide so that there's access. I know that there have been a lot of initiatives in recent years to try to build better partnerships and more communication and collaboration, and I'm looking forward to learning more about what's been working well in those conversations and some of those meetings and forums, and where there have been some challenges and where we can find opportunities to build on that work. I'm very much interested on this subject and every other in finding ways to build on the foundation of what we already have, not try to reinvent things from scratch, but figure out ways where that we can do work together in a collaborative manner that is as effective as possible, keeping as kind of the North Star the interests of the community that we serve. And I think we're going to talk a little bit later about contracting and budgeting, and I know those are both just real significant nuts and bolts issues that affect everyone, right? Every department, every organization, every contractor. But in addition to kind of those types of conversations, one of the things I'm interested in learning more about, and that I would invite folks to share their thoughts on, is what are ways in which we can find creative opportunities to expand access, improve services, break down barriers for people, and do so in collaboration. And if that means changes in state regulations or funding opportunities that we can seek collaboratively, I think there's tremendous strength and value there, and that's something that I have a lot of interest in, and I hope that many of you do too.
Any follow-up questions on the nonprofit partnerships? Awesome.
Yes, my next question is on racial equity. Over 150 nonprofit in Santa Clara County signed the Racial Equity Pledge. There has been much progress we have done, but there is also a lot of work that needs to be done on that. Can you speak to your personal commitment and the county's commitment to advancing racial equity?
Absolutely. Equity has to be at the core of what we do as a county organization. It's, the reason that I'm in public service, I'll take the personal piece first. The reason I'm in public service is because I believe very deeply in the power of government to help our community, to help address inequities, to help support and provide services. And that's why I love the county, like I said earlier. It's because it's about providing safety net services, and across each and every program, you can't do that without reflecting upon and recognizing the extraordinary history of specifically racial inequity, but also other forms of inequity and injustice. I think the county has made a lot of good efforts in the last few years to be much more explicit about work that I think historically has been more implicit in the programming of the county, to talk openly and directly about diversity, equity, and belonging, including creation of an office dedicated to that, about the establishment, and this was its first year, and so it'll need to be iterated and built upon, but a budget equity tool. And I'm sure there'll be enhancements and modifications as that's institutionalized as part of just how we think about budgeting, for example. But doing the same thing across the services and programs that we offer. And some departments have been doing that in more explicit ways for a while, and others haven't as much and need support and encouragement and direction to be moving more aggressively in that vein. And so I look forward to supporting that and building on that. I also just reflect on one of the things that I think is such a powerful strength of our county organization and of this place we're situated, meaning the geographic area of Santa Clara County. We have always had, I think, such protective, strong, nationally leading policies, for example, on immigrants' rights issues, on our policy related to non-cooperation with ICE, for example, one that's been particularly litigated, but many, many, many others that I think reflect the fact that there is deep recognition of our strength here being in the diversity of our community and how that reflects not just in terms of the folks that we serve, but even internally in the organization. We have an incredibly diverse workforce, and that's something that I think is really critical as well. One of the other things that I think the county is really building on, it still needs to grow, but I think we're leading on is language access. And I call that out specifically because we did a lot in that vein during COVID and really led on that during COVID. And I think that's now become something that we're institutionalizing throughout the organization in a leading way, encouraging the state, for example, to just build it into the framework for emergency response. So there's many other examples I could give too, but I'll pause there. But you cannot be successful in being a county, period, I believe, without having this be front and center with everything that you do.
Thank you. Any audience questions around racial equity? Yeah.
Hi, I'm Chuck Cantrell.
You have a mic right next to you.
Oh, thank you. I'm Chuck Cantrell. I'm actually curious about any specific targets, specifically around African American community in the county, that you might be looking at. As I've been here a while and I've watched the decline of the African American population here year over year over year over year. And equity obviously plays a tremendous role in that. And I'm interested to know any metric you're using, anything you're watching, anything you're doing to really focus on that fact.
Yeah, that's a great question. I don't think I'm not aware of any specific kind of numerical targets or metrics, and I don't know if you're referring specifically to employment or contracting or what particular category. I do think that there is a lot of attention. Many departments I know have paid a lot of attention to the data regarding disproportionality with the clients that we serve, and that's especially, of course, true in the criminal justice system, but across the other systems that the county runs, including our health and hospital system and social services. And of course, there's a lot of intersectionality between all of those as well. And I think it's important to continue to bring that data forward and have conversations around that. It is very important also, I think, that the county workforce reflect the community. And I think the numbers that I've seen, that's largely true. That doesn't mean that there aren't areas for improvement. But I don't think you can effectively serve the community if you don't reflect it. And I think that's really important too.
Let's see. Kathleen's got her hand up here.
I can use my adult voice.
And Kathy, did you have your hand up too? Okay, she's right there.
explain, this is Kathy Cordova with Recovery Cafe San Jose and the Real Coalition. Can you talk a little bit about those budget equity tools? I think it's very important for nonprofits to understand how those that lens impacts budget.
Yeah, that's a great question that I think is probably best answered by Greg Couturier, our budget director, and by Ana Lilia Garcia, who's the head of our Office of Diversity, Equity, Belonging. They jointly worked with their staff in developing that tool. It's its first year. What I can say about it is that it's requiring departments to actually consciously discuss the impact that any specific proposal has on equity and to provide a narrative. It's a pilot tool, right? It's going to need to be refined and expanded on. The whole budget process is something that I'm participating in this year for the first time in a deep way, but I'm not the county executive yet, and so I am giving a lot of thought and will be over the coming year to just how the budgeting process works and what to build on and change. But one piece of it is going to be to get feedback from departments, for example, on this tool and how it did or didn't affect decision making and what they recommended or proposed. So I think it's going to be iterative. It has to be iterative. It's a start, but it's an explicit start.
Thank you. Okay, got Mark, and then we have Kathleen, and then we're going to move to a question on budget. And we have one more, yeah.
There we go. Sorry, couldn't see. Mark Fischler. I'm with Parents Helping Parents. We serve families raising children with disabilities, and we believe there's a real intersectionality between race and disability. We see it every day because our busiest areas that we serve are East San Jose and Gilroy. So my question for you, I think there's been a lot of good things that the county has done, like establishing an Office of Disability Affairs, but I'll give you an example that I think the county needs to do better. 2 years ago, when getting the COVID vaccine was like Hunger Games, the county, Dr. Cody and her team did a great job, but quite frankly, people with disabilities and their caregivers were not prioritized. And when you came to having all the dashboards that you had, you could break down the data several ways, but people with disabilities were nowhere to be found. And it was really hard to tell how the county was doing getting those people vaccinated. So my question to you is, what more, and what, in your opinion, what can the county do to serve the disability community and make sure that equity includes people with disabilities?
Well, as you know, this was actually one item that was on the board's agenda this week, talking about some of the work of the new Office of Disability Affairs and thinking about how that becomes more embedded in the work of the county organization. One of the things you raised, though, with respect to kind of COVID vaccination is data. And one thing that was really clear through that process was, we were very dependent on a state system called CalReady, which is a state system for putting together kind of case data, and then the state had an analogous system for vaccine data used by counties. And we had challenges not only in terms of, there's no data being gathered through that system from providers regarding disability and access, but also, for example, and this is a big deal for our community, just one generic category of Asian with no disaggregation. Well, that's a big deal, right, to actually see what's happening in Santa Clara County. Those are just two examples, but there's many others. And reliance on those kinds of data sets, because of course the county was delivering a lot of vaccine, but so was Kaiser, and so was Sutter, and so were other entities, and so all of that's just feeding into kind of one system. And I think there's a lot that needs to be done to deal with data sets and systems, both locally, the ones that we have control over and where we're gathering information so that we have that richness in order to help inform decision-making and identify where there are issues, but also strong advocacy at the state level, because otherwise you can't compare what's happening. We operate as a region on a lot of things, and we also depend in a lot of these, a lot of areas where we provide services on these state kind of mandated data sets, and the state, I think, is way behind, and something that, an area where I think we really need to push that those data sets are expanded and enriched as well.
Thank you. Okay, we have one question in the front row, and then Yvonne, there's one right in back of you in the next row, and then we'll move to budget.
Okay, it's Kathleen King, Healthier Kids Foundation. On the budget equity tool, are you willing to share it with the CBOs? We have our own equity tools, and we would love to give feedback on yours and share what we're doing with our equity tools. So is that a possibility?
Yeah, absolutely. And as far as I'm aware, it's a public document. Might even be posted on some website somewhere. But
I don't know who we send our feedback to.
that's a good question, and something that I'll need to follow up on, because I don't know if that's going to belong more to OBA or that's going to belong more to Office of Diversity, Equity, and Belonging, or so. We'll have to figure out. I know they're both working in partnership on that tool and have collaborated very deeply on that tool, but I don't know which one is going to take the lead on all the feedback from its first implementation.
We'll just send it to both Kathleen and then let these guys work it out.
I am Darlene. Wow, it's so loud. Darlene Tennis from Farm Worker Caravan. And we, of course, we're the Valley of Heart's Delight, but we still have a large agricultural community in South County, Morgan Hill, Gilroy, that I feel is pretty much ignored. And part of it, too, again, you were talking about the languages. 6 out of 10 farm workers are from small village in Mexico where they speak indigenous languages. So what are the indigenous, what are you providing for the indigenous community? Also, there's the housing issues, as we saw in Half Moon Bay. That's happening here in Santa Clara County. What kind of oversight is being done on housing for that agricultural community? And just what services are being provided at all, because I haven't seen it.
Well, what I can say on that is I know that there are a lot of conversations that have been happening through the board's Hewlett Committee on ag housing specifically, and those issues. There have been some initiatives that I don't think have been all that fruitful, frankly, in getting housing actually built. But that's an active conversation on thinking through how to address combinations of state and local regulations that have impeded that, and that there's more to do on that front. In terms of some of the issues in San Mateo County that we've seen, there's been a lot of effort in the last couple of years to really reinvigorate our code enforcement, and a lot of that code enforcement work has focused on in some cases, some very troubling substandard housing situations in rural unincorporated county, which is where the county does have its land use, jurisdiction and responsibility. I think we've seen a significant increase in those efforts. When I started as the county counsel, there was no active code enforcement program in the county at all. We didn't have any attorneys, for example, so people get notices of violation, but there was no effort to kind of follow up with enforcement. There just wasn't, those resources weren't there. And the board did support the creation of a dedicated team. That team has grown and expanded. The work has increased significantly. We actually recently completely revamped all the applicable enforcement ordinances. So there's a lot more that's happening there, and it's continuing to evolve, but is making, I think, an impact.
I think I want to be clear with everybody that it's not just San Mateo, it is Santa Clara County.
and people, unhoused people, and farm workers who are full-time employees, but living like unhoused people, are living in third world conditions in Santa Clara County.
Oh, no, absolutely. I wasn't suggesting that we don't have a problem in Santa Clara County. In fact, we have taken some significant action against some of those housing developments, or whatever you want to call them. I mean, they're not really housing developments. They're substandard, dangerous dwellings that we've red tagged and gone after the folks who own the land and have made money off of supporting and perpetuating that kind of substandard housing.
Okay, thanks audience for your questions, and we're going to move on to a couple moderator questions. Elisa has 3 questions, and just as a heads up, topics are budget, CBO contracting, and behavioral health. So just getting wrap your head around those topics. Just, tiny little topics. No pressure to the 2 of you, but we are a little behind, so just FYI.
Okay, well, I won't do my long lead into this question, but thank you for sharing your interest in budget and contracting already. What's standing out for you in this year's budget and the longer term forecast that we're hearing? What would be helpful for everyone to hear about those issues?
Yeah, I think that's a really important question. I was joking with Jeff that he's kind of handing things over to me when we're entering a very different budget picture and environment. For those of you who don't know, we're facing about a $120 million structural deficit for this upcoming year's budget, and we anticipate that will be worse in the following year. And that I don't think should be a shock to folks in the sense that our main sources of revenue are just not growing the way that they had the last several years. So, to simplify it, to grossly oversimplify it, we kind of have 3 main, sources of revenue. We have federal revenue, which with the change in Congress, isn't going to be growing at the same type of pace that it did in prior years, and a lot of one-time money that came from the federal level in response to the COVID emergency is not going to continue. We get a big chunk from state subventions, and I think you're all aware that the state budget forecast has shifted and, of course, bounces up and down, very heavily dependent on capital gains, right, which is essentially the stock market. And so that's, that for better or for worse, that is what it is. And so the state budget picture has shifted pretty significantly. And then our big local source of revenue is property tax, which does tend to be more stable, but the growth, right, the rate of growth is looking very, very, very different. And anyone who's paid attention to the volume of sales and transactions, that's plummeted so significantly. And without turnover because of Prop 13, you don't get reassessments and revaluation. And so, the roll growth, rate of roll growth is significantly down. So when you look at all 3 of those major pieces, you see why there's a budget picture where revenue growth isn't in a position to keep up with expense growth. And so I think the challenge for us as a county organization, and it's a challenge I think that's a collective challenge for all of us, is how do we continue to find ways to expand and support safety net services in a time where we're not having the revenue growth to do so. I think one important piece of that is state advocacy and what happens in the choices that the state makes or doesn't make and how they deal with their budget situation and what they do or don't push down to counties or how they treat investments or not in counties because of how significant the fiscal interrelationship is between the state and counties. Another part is the opportunities that we have to find more effective ways to try to draw down state and federal resources. And then to look really thoughtfully at, what have we been doing the last many years. We've been very fortunate, right, to have many, many years of really strong growth locally. And, how are we going to prioritize? And as we enter a time where there's going to be, reductions at the county level in order to balance the budget. So we're facing that for the budget that's coming up. And I think that will be much, much more significant in the following year.
I think we're going to go to the next question just to catch up a little bit, and then we'll take audience questions on budget and contract.
Okay, let me just do a quick follow-up. I'm sorry, Kira, but a few years ago, I remember Supervisor Chavez rallied many of the people in this room for a couple different phone calls that you were on around what we needed to do to advocate with the state around ERAF. How do we get that kind of energy in an ongoing basis as, you and the county is advocating? How do we engage everyone?
I think that's a great question. I'm glad you brought it up too, because I'm very concerned about a renewed threat to ERAF because the state's budget picture has shifted and it's an ongoing concern. So obviously not just limited to that particular issue, but that's a really important one for us because that's a significant amount of basically property tax revenue is what it really is. It's really about the allocation of local property tax revenue. And we do see that as being at threat again. I think if we can come up with some mechanisms to, as the state budget process really ramps up, which is, around the time of the May revise, and between that time and all those budget trailer bills coming out, which is where there's always, sometimes dangerous goodies hidden, that, I think that's the right time to be ready to move very quickly, and sometimes you have to move very quickly to respond and push back. And I think it would make sense for us to figure out opportunities, whether it's through SVCN or other venues to be able to rally together. Because I thought it was very effective, and we were able to make a significant shift in that particular trailer bill proposal, and that made a huge difference, huge. And I think we probably will need to do something like that again.
Thanks. You referred to some of the ongoing work that the Office of Procurement and Contracting have been doing with nonprofits. How can we continue to move those conversations forward? I heard your commitment. And are there specific aspects of contracting in the short term or in the long term that you'd like to share?
Yeah, I think, so I know contracting at the county can have many aspects that are frustrating, I think, for everybody all the way around. I'll share one really significant long-term goal vision that I have for procurement and contracting that I think is a pivotal necessity to helping with all pieces of that process. And that is that we don't have good infrastructure internally in the county organization. Supervisor Chavez actually alluded to this as part of a conversation that was had at the board, if some of you were paying attention to that, but around kind of the strategic priorities for the organization, one of the strategic planning sessions around some kind of core infrastructure. We don't have great internal systems and data sets around contracting, and as a result, it's not only just a largely decentralized process for service contracting, but one where it's hard to have a lot of visibility for anyone into all the different pieces. And so I know that's a challenge, I think, for contractors, but it's an equally, if not greater challenge, candidly, for departments and for administration, because it makes it very hard to see things and to know where, what's going on where and how and where to make improvements. And I think until that infrastructure piece is really addressed, it's, from my personal perspective, having worked on contracting issues for a number of years at the county, I think a lot of the rest of it is are important, but more Band-Aid solutions. And I'll share one, at the risk of giving too many lawyerly type examples, but I'll share one example from when I first came to the county. I had this teeny tiny item that I was assigned, and working with the state AG's office and trying to figure out, there's an antitrust action related to computer monitors, CRT and LCD monitors, and how many did the county buy in the last 10 years so we could file a claim? Really discreet question. And it was unbelievable. We couldn't figure out the answer to that question. We had to try to go to every single department and try to get each department to try to go count and figure out what they maybe had purchased in the last decade. And of course, people didn't have necessarily great records. You know, super discreet issue. There's nothing complicated like trying to figure out the best way to deliver, you know, wraparound services or something like that. And you know, that is the kind of thing when I'm talking about that, I think it's perhaps most frustrating to department heads and to administrators on trying to figure out, you know, some of these pieces without having that infrastructure in place.
All right, any audience questions on contracting or budget? Okay. And then we're going to do two and then move on because we're...
Thank you. I'm Michelle. I'm with Almaden Valley Counseling Service. And we don't contract for Medi-Cal for behavioral health, but we do serve what a couple of county supervisors have called the missing middle. And even though we're in Almaden Valley, about over 40% of our outpatient clients make less than $25,000 a year. And right above that, we have people who make less than $35,000 and $45,000. So they are definitely that missing middle beyond the Medi-Cal cutoff, but certainly not making enough to survive. And so I'm not exactly sure what my question is regarding this, other than, is there some way that you can also include that segment of the population when you are looking at this deficit budget? And we are going to be applying for county supervisor inventory funding, yes, but I do want to bring that part of the population up as part of this conversation. Thank you.
Thank you. You know, it's definitely part of the conversation at the board. It's definitely something that people are aware of. You know, but it's also it's tough in the context of you know, limited resources, and I think the county needs to try to do everything that it can, and I think we also collectively need to try to do everything we can to try to bring in more resources to be able to expand access to include as many people as possible and as many people who have very real needs.
Hey, James, this is Poncho Guevara from Sacred Heart Community Service. Thank you for being here this morning. This is related to a number of the topics we just talked about, but particularly around the budget, is I want to talk to you about the jail. And there's been a lot of work that's happened by a coalition of organizations, including folks up on the panel and folks out here that have been talking about, we need to radically reimagine what's happening in terms of how we're over-incarcerating communities, especially communities of color in our valley. And we're expending a tremendous amount of resources on something that has not proven to actually work in terms of keeping our community safer and other things, and we've had some opportunity to work on this. I know there's an Alternatives to Incarceration task force and some other things, and there are some challenges with that process right now that have been hung up. But I'm curious to see, are you going to be as stubborn as the previous administration in terms of thinking about, we're going to go replace the main jail because that's how we always do things, and there's a commitment of funding from the state to be able to do it, and pig-headedly moving forward in a direction that hasn't necessarily proven that we're doing the right thing. And I'm curious. I'm not asking you, are you pig-headed? But you can interpret it however you want to. How willing are you to help lead the county for what could be one of the biggest transformation and leadership things that we could be doing in our valley? Is really rethinking how do we deal with these issues? We've already worked on getting the Board of Supervisors to prioritize mental health, you know, focus and facilities and other resources to do that. How committed are you to help lead that challenge, even if we're driving policy change that really hasn't happened hardly anywhere in this country?
Yeah, I think that it is so critical for us to be thinking deeply and thoughtfully about the entire criminal justice system and the many, many things that are not working well in that system, and pushing for really meaningful reforms and changes. There's so many parts of the criminal justice system process where there's different actors involved, and decisions that they make from their specific lens may make sense from that specific lens, but have a lot of downstream and complex interactions, right? And so if you think about the roles that the independently elected district attorney has, and the sheriff, and the public defender's office, and probation, but also the court and decisions that individual judges make, and the combined effect that you get with all of that. We need to push on those things, for sure. I will also just say, though, that when the court orders someone committed to the county's custody, we also have an obligation, I think a moral obligation, to make sure that the conditions of confinement, whether we agree or not, right, with the fact of what the court did through that process, that the conditions of confinement are as humane as possible. I'm not going to say humane because I think there's some deep fundamental challenges to kind of the carceral system, period. But I also think that the facilities that we currently have are really, really problematic in a lot of ways. So we have to figure out both those pieces, because as long as we have people who are that we are legally obligated to care for, we have to be doing so in a way that is as appropriate as possible. And so we need to work together to figure out how we push on those reforms, how we look at the population that is being brought into custody, how we look at things like length of stay, for example, how we comply with federal consent decrees that we do have, and that we have because there have been some real problems that we have to address in how we're caring for, both in the services being provided, but also in the facilities in which they're being provided. Those people that we have an obligation to be providing for their care because they've been committed to us. So I know it's a challenging conversation. I do think it's one where we need to be exploring all different kinds of options simultaneously. It's one where there's pieces that are in our control locally, and there's pieces that are not. There's pieces that are legislative. There's pieces that are judicial. But there are pieces that we can control too, and we need to move all the levers that we can locally and through advocacy to try to have our system be as much of a model as it can be.
Back to you.
Okay. And here, I'll shorten this. Our county has had a really strong commitment to meeting the skyrocketing need for behavioral health services. And the Mental Health Services Act is about a third of the funding for our county behavioral health budget. We have, in the 3-year plan, spending of about $172 million each year. And then all of a sudden, the governor came out with a proposal to reform the Mental Health Services Act and focus on people who are unhoused and specific services that may not totally align with how we've been spending it. What's going to be your approach in order to ensure that we keep a robust array of prevention services if that if the state moves through with that focus?
I think this is a really important question. I think it connects back to some of the things we were talking about around advocacy and around, what's happening at the state level. Yeah, I'm definitely concerned about, we haven't seen the details, right? The devil's always in the details. The details around the proposed changes, because it is, obviously the behavioral health system is top priority for the board. I think that's apparent to anyone who's paying attention to what's going on at the county locally. But that is the pivotal funding source, and so changes made there will have a tremendous effect. And I'm not going to pretend to even suggest that somehow there's general fund money to undo or make up for significant shifts if the state makes them in that funding source. That would just be false. There's things we can do, of course, on the margin, but it matters a lot what happens with MHSA funding and how much of it comes and how it comes and what restrictions. And so there's some pieces of the proposed reforms that I think look, and again, we haven't seen the details, but look like they're potentially positive in terms of flexibility and innovation. And there's other pieces that look like they could be a significant shift away from service delivery towards other things. That I think could really set back a lot of important work and investments that we've made in the last few years. So I think it's an area where right now we should be all collectively looking carefully. We should be prepared, I think, to take strong advocacy, because I do think there's the ability to help shape those details. I think I don't think that, I don't think the legislature is likely to just sign off with no changes to whatever might be proposed, right? So I think there's opportunities to help influence and affect what's happening. And we need to take advantage of those, because what we'd like to, I think, see is ways to use the funding more flexibly in order to enhance and build on the work that we've done, but not diversion of funding away from the direction we've been trying to head in terms of the investments we've been making locally.
Thanks.
All right. I'm going to take a moderator's privilege and skip the audience question for now, wait till the end because we're running out of time. David has two questions. One is about housing and homelessness, not surprisingly, and the other one is about civic engagement.
Great, yeah, let's start with housing and homelessness. And at Destination Home, and I think for many of us, we've been really pleased over in recent years how the county's really stepped up their leadership in addressing this issue. Everything from the Measure A housing bond to paying for services for unhoused individuals to homelessness prevention, things like that. But we're also kind of at this weird point, right? Inflection point. There's public frustration that's high. We see other jurisdictions or elected officials wanting to shift direction. And so I think what I'm curious about, I know many people want to know, is how do you see the county's role in housing and homelessness going forward, and any specific priorities you may have?
Well, I think the first thing I want to say is I just want to give a huge shout out to Consuelo, to Key, to the teams that have been working for the last several years to build the county's programming, to build the Office of Supportive Housing into what it is today, with the political leadership of the board in seeking Measure A and getting that across the finish line. The county has done such incredible work, and I think taken a really important philosophical approach to that work in supporting permanent supportive housing for those with the greatest needs in a way that's different, I think, from some of the conversation around those issues elsewhere. And I'm very, very proud of that and very supportive of the county staff who've led those efforts and done the hard work, and the partnerships that we've had with many, many organizations, with cities, with Destination Home, with others, to make that happen and make that a reality. So that's an area where I think what you'll see from me is real support for continuing the efforts that we've made. Measure A funding is running out. And so what happens next there, I think, is a big question that's ultimately, of course, a political question, right, in terms of, does something else happen to get another revenue source, right? And what that looks like. So I'm not going to speculate on that, but really important work that I hope that there will be that kind of funding to continue and build on. But regardless, commitment by the county to maintain the services and find whatever ways we can to expand and build on that. And I'm happy to say, for example, that none of the staff in the Office of Supportive Housing were funded from the bond proceeds, which could have been done because you can charge project costs, right, even though it's for capital. That's good, because that means we're not in a position where there's going to be some big cliff falling off on that front. So I think there's been a lot of smart ways that things have been invested to ensure that there can be continuity of service delivery. But that is a big question that does need to be addressed.
Great. The second question is somewhat related, but I think for those of us, many of us who are working in homelessness, but this is more broadly for all of us, is really trying to have an effort over the past few years to really center the voices of people with lived experience, right? Whether that be for us, people who have been unhoused, or for others, people who we're trying to serve, right? And they're bringing their perspectives in this work because we know it works better, right? Everything is better if we can center that. And so as the nonprofit community has been trying to do more of that, we've also been looking for jurisdictions to have that same commitment. So I'd just be curious, any thoughts you have on how you feel about that and how you see either your role as CEO or the county really trying to get into that?
Yeah, I'll share kind of two thoughts on that. One is I definitely agree that, finding ways in how you design a program and do an operation, especially when you're talking about a service, right? You're talking about a service. You're trying to serve folks who have a need, or there's something that is going on. Integrating feedback, their experience into the design of that is pivotal to success for anything you do. If you kind of want to know what my philosophical big picture take on that is, this will be a totally different context, totally different context, but did a lot of work on civic engagement and as a student decades ago, on trying to ensure student voices were involved in policy making and decision making and budgeting and hiring, all sorts of things. And even years ago, co-edited a book called Students as Colleagues that was all about engaging students in decision-making around things like curriculum design and around policies and decision-making in order to ensure that perspective was part of the conversation. It didn't necessarily drive or dictate everything, but it was an important embedded part of the conversation that was happening. So that's long been my philosophical orientation, but I think that's true for every kind of program that you have, and that's how you, I think, succeed.
Thank you both. All right, audience questions. I think we have one over here.
Carlos Rosario with Bay Area Community Health. I had a question, given how the pandemic's calmed down and there's fewer one-time funding, what you see as the future of the role of the county vis-a-vis the community health centers. I mean, you're seeing consolidation amongst the health centers. There's lots of behavioral health services that we can deploy if the repayments were done differently. So how do you see that moving forward, if at all? I know we're only a small part of the county's health force, but we serve a few 100,000 patients in the county.
Yeah, and I think it's an important part of the overall healthcare delivery network, right? For those that the county, in aggregate, right, is responsible for and is trying to provide access. The county's made such significant investments overall, right, in our healthcare delivery system, and we have to figure out ways to try to continue that. It's tough, right? It's tough with a changing fiscal environment. It's also tough with a changing federal and state landscape too, especially federal. And especially as court decisions continue to chip away at the Affordable Care Act, which was so pivotal to helping us transform what we were able to do locally. So, finding those avenues is something that's really important. Our health and hospital system writ large, and by that I don't just mean literally the county delivered. Obviously it's the hospitals, the 3 hospitals, obviously the county clinics, but it's also part of the broader, safety net that the county, that's part of the county network, right? We're going to have to, I think, find ways to try to better maximize drawing down federal and state resources collaboratively in order to be able to support the continued expansion of access. There's been a lot of good efforts in that regard. I think some of the investments, for example, that were made first by the county, but then the county supporting our community clinics in getting on one kind of electronic medical record system, right? Part of that is about being able to better draw down, those federal and state resources, particularly federal. But that's an example of the kind of thing that I think we need to continue to be thinking about and looking for, because that's how we bring collectively the resources into the system overall to be able to support, and not just continuing what we're doing now, but expanding access and services.
Okay, thank you, Carlos. Thank you, James. I think Kathy's next.
Kathy Cordova, Recovery Cafe. As a close observer for many years, the relationship between the county and the city of San Jose has been either collaborative or contentious. What do you foresee being the ability to work together on some of these major issues over the next few years?
Well, I'll say several different things about that. So one is every opportunity, vehicle, avenue that we have to partner, we should, especially in a time where there's less fiscal resources, and wherever we can find areas of mutual interest, we should. We also have to recognize that cities and counties have different roles, right, to play, and counties are focused on service delivery and safety net services, and cities have a mission and focus that's much more focused on things like land use and development activity, and that's okay. I mean, there's different roles. That's why they're different entities. But wherever we can find opportunities to collaborate, we should. And one great area where I think the collaboration between the county and the city has been very successful, actually, is on housing issues. And it's been very fruitful, and I think it's been very mutually beneficial, and I look forward to that continuing. I also don't want to leave out the other cities. So we all talk about San Jose. Of course we do. It's a majority of the population in our county. But don't want to forget that we have 14 other cities in our county as well. And because they're much smaller, are very differently situated. And I think the county has to lean in a little more into helping play a convening and coordinating role with some of those. And they're very differently situated, the different cities, and some of them are in certain special districts and some are not, and some of them are part of the county library system and some are not, and all sorts of different things, right? But there's a lot, I think, to build on there as well, in terms of collaboration and partnership that's important too. So, but we're a bit funky as a county in having, unlike say San Mateo or other places where we have this one really big city that's actually a majority of the entire county population, and then a lot of much smaller cities, and that creates some just different dynamics.
Okay, I think you have a couple of questions in the back here.
Hi, my name is Ann Maloney, and I'm involved in K-12 social impact education. And I'm curious, just as you discuss, barriers to access and the hope to improve and expand services, and then you also talk about the state mandated data sets and piloting tools and trying to, obtain greater visibility into contracting and greater coordination across CBOs and the cities and the county. Who are you looking to in terms of models? Like, who's doing this really well? Other counties or, in terms of our adjacent counties? What's inspiring you, and what are you looking to help in this process that's happening all over the state and beyond?
That's a wonderful question. I think there's lots to learn from lots of different places and not just in California, but across the country. Now, sometimes you have to, things aren't necessarily directly adaptable when you're looking, especially outside of California, but even elsewhere in California. But lots of, I think, great examples of programs. Though a lot of the work that the county's actually been doing on racial equity issues, for example, is built on some of the work that's come out of communities like King County in Washington, for instance, right, which has really led on some of those issues for a number of years. There's work that has in terms of city collaboration. It's a different model, so it's not apples to apples, but I feel like from what I've seen that San Mateo actually has really great city-county partnerships. Now, they don't have one big city, right, in the same way. So again, it's not apples to apples, but has found ways to work in really good collaboration across I think they have 22 cities in San Mateo County in partnerships. So there are, I think, a lot of good examples out there. And there's a lot of ways in which I think we're a leader and distinctive, and we also need to figure out ways to share our work better, too. I don't think we always do a good job of that, and that's a way we can also be building coalitions and partnerships to help drive state changes, right? Where, for example, I'll give one specific example. We have the only independent pretrial services office in the state. And there's been some interest sporadically elsewhere in the state around that. But that's a space where we could be partnering with other counties to help them implement some of those things.
Okay, we have time for one more question. I don't know who's going to have to battle it out between you and Yvonne or Alan.
All right. My name is Jose Villarreal. I'm with Downtown Streets team. I've heard a theme mainly about collaboration, trying to figure out how to collaborate between county and city. I think the one thing that I want to hear from you and my question to you is, like, how can the county ensure that organizations collaborate with each other? Because one thing that I've noticed, especially working with the HMIS system, I'm not sure if you're familiar with that. It's the data collection system that we use as case managers. A houseless person can have 4 case managers from 4 different organizations, and they are all doing the same work, and basically running in circles without working together. And I'm just curious as to what can the county do to ensure that there's true collaboration? Because at the end of the day, we're all competing for the same money. We're all competing for the same grants and stuff. But is there any way that the county can ensure some type of incentive for collaboration? Because there's so many organizations within the county, and I don't know how many really are working together, truly working together in order to try to end homelessness, inside Santa Clara County. So I'm just curious, is there anything that you can do? Is there any incentives that you can do in your contracts, in your grants? That's my question.
Yeah, I think that's a lovely question. Undoubtedly there are. But one of the things, and I think this is probably a good way to kind of close our conversation a little bit, is there are definitely ways to promote and support that. But we have to identify those together, and I would look to all of you to be thinking about what some of those things might be and what they might look like. I could perhaps think of some ideas, but that would never be an effective thing for just coming kind of off the top of my head, right? That's something where what are the ways in which organizations can partner together? What are the structures that would incentivize that or structures that would encourage that. I think that's something that I would actually look to this community and others to be thinking about identifying, what are those pain points? What are the things that might actually be effective? How do we track and measure that? How do we figure it out? If we experiment with something and it doesn't work, how do we move on to the next idea? Because we have to always continually do that. And also circumstances and things change, right, over time too. So I look forward to trying to figure out the right, venues for those conversations to happen with the right folks, but would really leave all of you with an invitation to be thinking about not just identifying the problems and issues, because we can all do that, but also thinking about, what are ways in which we can also collectively identify solutions and ideas, or at least ideas to try.
All right, thank you. Unfortunately, we're out of time. Clearly, we need a second town hall. We will be scheduling that with James right after this meeting. Thank you so much, James, to you for your candor and to the audience for your engagement, to the moderators for their great questions, and I'm handing it back to Yvonne.
Yes, actually, before you run, James, since we didn't get to all the questions, I was wondering if you'd be willing to answer some of them if we email them to you later. So if they send us their questions, the ones that weren't answered, if you wouldn't mind taking a look at that, we can disperse it out. Thank you. Thank you so much. So thank you again, everyone, for joining us today. And we know that this is the start of a very important dialogue with our county leadership, and we're happy we could start it and kick it off right today. Big thanks to all of our panelists and to James Williams for joining us today.
Thank you. And I just want to say a huge thank you to all of you for your thoughtful questions, and looking forward to working with you.
Thank you again so very much for coming today. I do want to put up on a slide all of our contact information so you know how to get a hold of your SVCN policy team. If you don't have our contacts, please take a photo of that one real quick. And on behalf of our team, we thank you for joining us today. We hope to see you again very soon.